Imagine waking up one morning to intense pain in your back. You think it's just a bad night's sleep or maybe a workout gone wrong. But then, the pain keeps coming back, day after day. For some people, this is life with ankylosing spondylitis, or AS. It's not just about pain, it's about a condition that affects your entire body, from your eyes to your heart. This video will give you a complete picture of AS, breaking down the complications, what they mean for your life, and how you can take control. What is ankylosing spondylitis? Ankylosing spondylitis is a chronic autoimmune condition, meaning the body mistakenly attacks itself. AS is most famous for causing severe pain in the back and buttocks, but as the disease progresses, it spreads, causing pain in the pelvis, hips, heels, and other large joints. Think of AS as an unwanted wildfire. It starts in one place and gradually takes over if you don't keep it in check. With AS, though, there are ways to limit that spread and slow down its effects. Complications associated with AS. 1. Eye problems. Did you know that up to half of people with AS experience eye inflammation? This inflammation, called uveitis or iritis, can make your eyes red, puffy, and sensitive to light. Your vision may blur, or you might see floating spots. It's more than just annoying. Without proper care, it can harm your vision permanently. Wearing sunglasses can help, but seeing an ophthalmologist regularly is crucial to ensure that inflammation doesn't escalate. 2. Reduced flexibility. AS doesn't just stay in your back, it can fuse the bones in your spine. Imagine trying to twist or bend, only to feel as if your back has turned into stone. That's what people with severe AS face. For some, the spine becomes so rigid that they can barely move. Fortunately, those who stick to a consistent treatment plan involving stretching and exercise often maintain better mobility. So, keeping active isn't just good advice, it's essential for maintaining freedom of movement. 3. Fatigue. Have you ever had a day where you felt exhausted for no reason? AS can make that the norm. The inflammation triggers the release of cytokines, which are proteins that sap your energy. Your body is fighting inflammation all the time, leaving you feeling worn out even after a full night's sleep. Fatigue from AS isn't simply tiredness, it's a daily struggle that can impact every aspect of your life. 4. Osteoporosis. Osteoporosis causes your bones to weaken, and with it, it's particularly dangerous. As inflammation wears down bone density, the spine is most affected. This increases the risk of fractures, especially in the lower back. According to studies, over half of people with AS have low bone density. Think of your bones like the framework of a house. When the framework becomes brittle, everything becomes unstable. That's why bone health should be a top priority for anyone with AS. 5. Gastrointestinal disorders. AS doesn't stop at the bones and joints, it often impacts your gut as well. Inflammation from AS can cause stomach pain, ulcers, diarrhea, and other digestive issues. Living with AS can mean dealing with two diseases in one, and gastrointestinal problems are no minor inconvenience. A gastroenterologist can work with your rheumatologist to help manage these symptoms and reduce discomfort. 6. Increased risk of heart disease. AS is associated with a higher risk of heart disease, which may include aortitis, aortic valve disease, or ischemic heart disease. These complications develop because AS causes long-term inflammation, impacting your heart and blood vessels. Imagine inflammation as rust slowly building up on metal. Over time, it causes breakdowns. Inflammation works similarly in your arteries and heart. Preventive steps, such as regular exercise, a healthy diet, and avoiding tobacco, can make a significant difference here. 7. Social and employment challenges. Living with AS affects more than your body, it can touch every part of your life. Chronic pain can make it tough to stay social, and working full-time becomes a challenge for some. Unfortunately, this isolation can contribute to feelings of depression and loneliness. But by actively engaging with support groups, staying active, and sticking to a treatment plan, you can reduce these effects and improve your quality of life. Less common but serious complications. 8. Cauda equina syndrome. Cauda equina syndrome is a rare but serious complication. With this condition, bone overgrowth from this presses on the nerves at the base of the spine, causing pain, numbness, and even incontinence. This condition can lead to paralysis if not treated immediately, often requiring emergency surgery. Recognizing symptoms like stinging sensations in your legs or difficulty walking is critical to avoid irreversible damage. 9. Amyloidosis. This rare condition occurs when the protein amyloid builds up in organs, potentially causing weight loss, water retention, and fatigue. In some cases, it even mimics nerve damage with tingling in the hands and feet. Amyloidosis isn't something everyone with AS will face, but it's essential to know the signs and get treatment if symptoms arise. Managing ankylosing spondylitis, treatment options. Fortunately, there are effective ways to manage AS and reduce its impact on your life. While there's no cure, treatment options can ease symptoms and slow disease progression. Nonsteroidal anti-inflammatory drugs, NSAIDs, these are often the first line of treatment to reduce inflammation and manage pain. Biologics, these injectable medications target specific immune system components, like TNF inhibitors or IL-17 inhibitors. By addressing these targets, biologics can effectively reduce inflammation. JAK inhibitors, this newer treatment works by inhibiting the JAK enzymes that signal the production of inflammatory proteins. Taken orally, JAK inhibitors offer another way to slow down AS. Corticosteroids, these can provide relief when injected directly into the joint, though they're typically not recommended for long-term use due to side effects. Physical activity, activities like swimming, biking, and physical therapy can help maintain flexibility, reduce stiffness, and improve your overall mood. Incorporating these into your weekly routine can help keep you moving and active. Finding support. Living with an autoimmune disease can sometimes feel like a solitary journey, but you're not alone. Support groups offer valuable connections, encouragement, and understanding. There are many ways to find a support group, whether through online forums, local hospitals, social workers, or religious organizations. Online groups can be a great option, allowing you to connect from home at any time. Conclusion. Ankylosing spondylitis may be a chronic condition with no cure, but that doesn't mean it has to control your life. With a solid treatment plan, regular checkups, and the right support system, you can manage complications and live a fulfilling life. Remember, the more you know about AS and its potential complications, the better prepared you'll be to handle the challenges it may bring. So, keep informed, stay active, and don't hesitate to reach out for support. Thank you for watching, and if you found this video helpful, don't forget to subscribe for more content on living well with chronic conditions.